Good evening. My name is Mark Barnico, and I'm the Executive Director of the University of Chicago Francis and Rose Yuan campus in Hong Kong. Our premier campus in Asia, representing UChicago values of free and open discourse, rigorous debate, and the exchange of ideas. Tonight, we're launching our new series, Our COVID Life, which will look at living with COVID, discuss what we've learned in the past 2 years, and consider approaches and technologies we can leverage to protect us in the future. We're sharing tonight's event live via Zoom, Facebook, and YouTube. If audience members have questions to submit, you can do so through the questions and answer button by first registering on Zoom. I also encourage you to visit our website at www.uchicago.hk and subscribe to our e-news for the latest news and information, or you can also follow us on our UChicago UN campus social media accounts on Facebook, Instagram, and Twitter. We'll wrap up tonight's program with a poll and more information about upcoming events you might be interested in. So be sure to stay tuned until the very end. Tonight's Our COVID Life program will explore public trust and vaccine hesitancy. Since the World Health Organization declared COVID-19 a pandemic in March 2020, and the first COVID-19 vaccine was approved and rolled out after December 2020, the vaccination rate in high and upper middle income countries has hovered around 70%. Building public trust for the safety and effectiveness of COVID-19 vaccines has been a global challenge during the pandemic. But what are the reasons behind the delay in acceptance or refusal of vaccines, despite the availability of vaccine services? Tonight, we'll explore how language, cultural norms, psychology, and the media challenge or win the public's trust when considering vaccination in Asia and in the West. So let's get started with brief introductions of our guest speakers tonight. Heidi Larson is a professor of anthropology, risk, and decision science, and is founding director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. She's also clinical professor of health metric sciences at the University of Washington in the United States, and a guest professor at the University of Antwerp in Belgium. Professor Larson's research focuses on the analysis of social and political factors that can affect uptake of health interventions and influence policies. Her particular interest is on risk and rumor management, from clinical trials to delivery, and building public trust. She's the author of Stuck: How Vaccine Rumors Start and Why They Don't Go Away, and Heidi tells us that it'll be available in Chinese very soon. Professor Larson previously headed global immunization communication at UNICEF, chaired Gavi, the Vaccine Alliances Advocacy Task Force, and served on the WHO Strategic Advisory Group of Experts on the Immunization Working Group on Vaccine Hesitancy. Dr. Xian is an assistant professor at the Department of Computer Science at Hong Kong Baptist University. She's the research coordinator of the initiative Overcoming Vaccine Hesitancy in Hong Kong, funded by Hong Kong Baptist University. This project aims to immediately share incremental findings of up-to-date research on vaccine hesitancy to help local authorities formulate more effective communication tactics promoting vaccination, and it couldn't be more important than it might be today. Professor Boaz Keysar is the William Benton Professor at the Department of Psychology, the University of Chicago. He's the Director of Multilingualism and Decision-Making Lab, which is dedicated to understanding the relationship between thinking, decision-making, negotiation, and communication. Professor Keysar's lab recently conducted a study in Hong Kong on the use of language intervention to reduce vaccine hesitancy. And there are some very interesting findings he'll be talking about tonight. Welcome to all of our panelists. Boaz, let's have you start us off by sharing some of your research finding for the work you did here in Hong Kong.
Thank you very much. I'm honored to be invited and to participate today. As Mark mentioned, the WHO has declared vaccine hesitancy as a major problem worldwide. And I know that the vaccine is causing a huge amount of problem now in Hong Kong with a big surge. And we also know that most people who are unfortunately dying these days around the world, most of them tend to be unvaccinated. And there is a consensus among scientists that reducing hesitancy could save lives and end the pandemic sooner. So last spring, our lab decided to put some effort into use what we know about language to see if we can contribute a little bit to address this problem. The team in my lab that worked on it was headed by Dr. Jeanette Gable, who was my postdoc and is now a professor at the University of Exeter in the UK, and my senior graduate student, Lee Grant. So in general, our research looks at how people make decisions, and we find that in different languages, people tend to make different kind of decisions, systematically different decisions. For example, they make different moral choices. They use a foreign language. They tend to be more utilitarian, for example. Jeanette finds that that they're more likely to take risks. There are several reasons for this. These differences, some of them are the emotional reaction that certain languages give us, a distance that tend to be kind of imposed by using a foreign language, the link to a culture that the language might provide. For example, in the context of health behavior, we find that in China, more people are open to accept mental health treatment when they use English than when they use Mandarin. Partly because the language connects you to cultural values that tend to not be so accepting of mental health treatment. So we asked whether language could impact how people react to communication that promotes vaccination. Basically, we wanted to know if you could use language to increase trust and as a result, reduce hesitancy. So we know that people tend to develop negative attitudes toward the vaccine. They're really concerned about the side effects. And in general, many people are unhappy about injecting substances into their body when they are not sure exactly what they are. The thing is that most of the information about side effects tend to be received in your native tongue, typically. So we reason that it's possible that if you move people away from their native tongue by using a foreign language, a language that is not associated with these symptoms, we might be able to remove some of the negative associations and perhaps increase some trust. Related to that, Jeanette Gable and her colleagues discovered that people are more accepting of novel technologies. And you can think about the vaccine as basically, it is a novel technology. So they're more accepting of novel technologies when they hear about them in a foreign language. They also perceive these technologies as less risky and more beneficial. And all this suggested to us that communicating information about the vaccine might actually lead them to trust it more and to be less hesitant. So we decided to do a study about that, and Hong Kong was the perfect location for us in last spring because the vaccination rate was relatively low there, and people are predominantly bilingual. A lot of people know English also in Hong Kong, of course. So we wanted to recruit about 600 participants, and that's a lot of people for us because they kind of had to do the study. They had to do the study online. So I must say that we thought that it'll take us a long time to get all these people. And maybe the pandemic will be over by the time we finish doing the study. Maybe everybody will be vaccinated by the time we finish doing the study. So speed of doing it was essential in conducting the study. Turns out I underestimated the skill and dedication of the women at the Hong Kong Center who ran the study for us. And, Kitty Chong and Angela Siu did it in a light speed. I have no idea how they were able to do this, but we are totally grateful to them. And I also want to take the opportunity to thank the participants who are also all from Hong Kong, and who knows, maybe some are listening right now. So we appreciate your help. So what did we do? We gave vaccine information, full vaccine information to participants, either in English or Cantonese. We randomly assigned them to receive the information in one of the two languages. And of course, everybody who received it was not vaccinated yet. And we asked them a variety of questions. The two most important for our purposes, we asked them, how much do you trust the vaccine? And are you willing to get vaccinated? And you could have answered, yes, I'm willing, no, or maybe. And here's what we found. People who refused to vaccinate, the language didn't affect them. In other words, we had about 19% of people who said no. They said 19% in English and 19% in Cantonese. The category of people who said maybe was affected by language. So people were more willing to vaccinate when they got the information in English, about 49% as opposed to 41% in Cantonese. And more people said yes in English than in Cantonese. So 40 as opposed to 32. This might look like, 7-8% difference might look like a small number, but when you think about the hundreds of millions of people who are affected by the vaccine, billions actually, these are big numbers, a big effect on people. People also said that they trusted the vaccine more when they received the information in English. And that measure of trust mediated their willingness to take the vaccine, meaning it partly explained why the language affected them. So what is important in this result is that it is not the information that people received that was important for their decision, because the information was identical. We made sure that we translated, back translated, and double checked everything. It was exactly the same information. So it wasn't the content, it was the language that made the difference here. So it really depends. People's decisions here depend on the language they get information. And that we thought could be explored further in other contexts, other places, other languages, and maybe what we found could be used as a nudge, as a cheap, actually a very cheap nudge, to push people gently towards vaccinating to reduce vaccine hesitancy. I think I'm passing the baton now to Xian.
Thanks for the introduction. So can I continue to introduce my work? So hello everyone. So I'm from the Department of Computer Science at Hong Kong Baptist University. So thanks for inviting me to this webinar. So today I'd like to share my experience in participating in the Overcoming Vaccine Hesitancy in Hong Kong initiative that has been conducted in Hong Kong Baptist University. So as a data scientist, I have done a lot of data analysis and predictive model construction for both social media and also survey data. So in the next few minutes, I'd like to first give a brief overview of this project and then introduce some example subtasks under this project. Some major implications will also be summarized at the end. So first, let me briefly introduce the overview of this project at Hong Kong Baptist University. The Overcoming Vaccine Hesitancy in Hong Kong initiative was launched in June last year, aiming to immediately share the incremental findings of up-to-date research vaccine hesitancy to help the authorities formulate more effective communication tactics to promote vaccination. Overcoming vaccine hesitancy would potentially promote the dynamic zero infection strategy as well. So in the project, we leverage a lot of advanced machine learning, deep learning, big data analytics, and also data mining techniques to investigate multiple facets of vaccine hesitancy in Hong Kong, in combination with application of traditional social science methods such as surveys, opinion polls, and also experiments. So this project contains a lot of subtasks. So we have published our reports on our BU webpage. So if you are interested, you can search this vaccine hesitancy in Hong Kong BU's webpage. So here I just want to highlight two example subtasks we have implemented. So the first one is about detecting public stance on vaccination. So we have employed the advanced text mining techniques and also big data analytics to monitor opinion expression in leading online forums such as Hong Kong Golden Forum, HK Discuss, and Baby Kingdom. So it is discovered from the forum data that the public stance on vaccination has shifted over time. The proportion of pro-vaccination comments have been growing since late February and early March 2021. So this may reflect the increased public awareness and knowledge of the effectiveness of vaccines and vaccination. So meanwhile, the peak period of stance flipping occurred between early June and mid-July 2021 when more people changed their stance from reactive to proactive. So we also found that the daily count of vaccine doses administered tend to be higher on the days when there were a large number of positive vaccine-related posts in the online forum. So this is about our example findings under this project. Another example subtask we have implemented is related to combat the mediated infodemics. So the spread of COVID-19 and vaccine-related misinformation on traditional and social media is misleading and potentially triggers vaccine hesitancy among the general public. So our project team has reviewed and content analyzed the clarification efforts by the Hong Kong government and fact-checking organizations to debunk such misinformation on major communication channels. It is found that social media is the main platform, while the misinformation circulates, whereas legacy media would occasionally report or quote inaccurate information. So most rumors involves misleading context on the risk of vaccination and false beliefs questioning the necessities of vaccination, and are often camouflaged with journalistic styles and scientific expertise. And importantly, misinformation about the vaccines and their side effects have begun to decrease since June 2021, implying a decreased level of public uncertainty about the vaccine risk. And the major implications of our projects can be summarized as like enhancing communication strategies, combating misinformation, and the use of innovative tools. For the first one about the enhancing the communication strategy, so based on our analysis, the current communication content and the channels can be optimized to accelerate the vaccination process. So we believe that the targeted communication and persuasion strategies, along with the integration of information resources, can help reduce the public's vaccination hesitancy to a certain extent. And for the second one about combating misinformation, the exposure to misinformation about COVID-19 can reduce the public intention of vaccination. So we suggest that the public sectors may consider combining urgent clarification of short-term rumors that have explosive public impacts with other long-term information clarification. And for the third one is about the use of innovative tools, which is also my main expertise. So as a data scientist in this project, we definitely use a lot of innovative tools from the area of machine learning and also data mining. So the innovative tools allow the authorities to understand and estimate vaccination trends and related public attitudes with a low cost and high efficiency. So our deep learning-based classifier, for example, can inform the policymakers of the public stance on COVID-19 vaccination in real time based on social media posts. So we also built a forecasting time series model to predict the number of daily vaccine doses to be administered in the near future. So such information constitutes a significant reference for future optimization of policies. So a lot of time series analysis methods, a lot of deep learning-based classification models have been introduced in our project. So to conclude, the project team has conducted consolidated research, generating insights that contribute to theoretical advances, put forward practical suggestions to promote vaccination, and created high quality content for public vaccination education. So apart from the potential contributions to real world vaccine campaigns, we also intend to make theoretical advances in this initiative. So extending the theme of overcoming vaccine hesitancy in Hong Kong, we are striving to develop new analytical approaches and the lines of research applicable anywhere. So we have developed a lot of new advanced data analysis methods as well. So such research output would of course be extremely valuable. So thanks for inviting me to this, and thanks for your attention as well. If you want to know more details, I think you can just go to our project webpage. You can just simply search the vaccine hesitancy in Hong Kong Baptist University, and you can find more information, and all my colleagues has put our findings as a report in the webpage for you to have a look. Yeah, that's all from my introduction. Yeah. Can I pass it to Professor Heidi?
Thanks very much. That was really excellent insights. I'm going to show a few slides here. I know we're talking about our COVID life, but I think a lot about trust and what the implications of our actions are, because one of the things I founded and direct the Vaccine Confidence Project since 2010, 12 years now, because we were already seeing some very concerning trends about public confidence in vaccines and the early emergence of some strengthening organized hesitancy and refusal movements. But one of the things we've found in the 12 years is the absolute crucial importance of underlying trust. And we've been watching this through the COVID time. And if there's one point I want to start with is that one of the biggest learnings we've had is how powerful history is in the individual personal histories, community histories. These experiences in the community mind, as well as individual, nationally, really are very strong levers of people's trust. We started a vaccine confidence index in my group. We established in 2015. We've been running it globally since then. The Wellcome Trust ran a global monitor on trust in science, and they had a special chapter on vaccines using our confidence index. And one of the findings was, which should make you happy, is that 95% of the people in South Asia, and I suppose you would be more in the East Asia, and that's not as high, but it's the global average is 77%. South Asia was the highest at 95%. East Asia was 68%. So you're higher than Europe and less than South Asia, which I imagine is we're thinking more about India, Pakistan, Bangladesh, and some of that would be due to sheer population size. But a point being that it's highly varied. And this is, I mean, that was from 2018 about vaccine hesitancy more broadly. But moving into our COVID life, at the beginning of the epidemic, sorry, this arrow seems to have migrated north. It was meant to be on Hong Kong here. This was a 32 country study we did on willingness to accept a COVID vaccine, and Hong Kong actually, and again, this was in December of 2020, so it was over a year ago, but it was an important time because it was just when we were about to roll out COVID vaccines. The intention to accept was quite high. There were quite a few in the yellow probably will not, which is that hesitant group, so to speak. But I thought the point that Boaz made initially about the obstinacy, you can call it, of the refusers, people who refuse vaccine, doesn't matter which language you have. There is, as one of my colleagues called it, she's a physician and writer, and she had talked about during the H1N1 pandemic, what she called emotional epidemiology. When it was first announced, her patients were saying, "Where's the vaccine? Where's the vaccine?" As it seemed that the pandemic was waning, people didn't want it anymore. But she said in COVID, she tries to have those conversations, and she talked about a unique obstinacy. So this stubbornness is quite strong. But the good news is, for those who are hesitant, there is a chance to influence them. In 2018, I wrote a piece during post H1N1 and Ebola and Zika. There were a lot of roundtables, a lot of discussions around, are we prepared for the next big one? And Nature asked me to write a piece. And I thought the one thing that we really have to pay attention to, which is probably not on the typical pandemic preparedness, which usually looks at supply, business resilience, infrastructure, governance, but forgets about people. I thought we should really be alert to the pandemic risk of viral misinformation. This was in 2018. And I have to say, when people ask me what surprises me about COVID, viral misinformation has been has been bad, but it has been far, far, far worse than I could have ever imagined, even having studied this field since the beginning of it emerging. It's become much more widespread. The sheer numbers have gone off the charts, because before, the people that we were monitoring social media and online media globally for a decade before COVID hit, those conversations were in certain groups of people that looked for information on vaccines, mothers, adolescents looking at HPV, some people around flu, less the elderly because they were less online when it came to older vaccines. But what's happened in COVID, just for the sheer reality that it affects everybody and all ages, over 5, let's say, are expected to be getting vaccines. That means the planet is online trying to, or in one way or the other, searching for vaccine information. And that has created an explosion. Just the search behavior has amplified the whole scale of this. But the misinformation is not only online. I think we spend sometimes having said we need to pay attention to it, sometimes I think we're kind of stuck on it, and particularly stuck on kind of debunking, fact checking, and not dealing with the underlying emotions driving these sentiments. How do you, I mean, these are people are taking to the streets, as you know, protests around the world, and then this sheer denialism that COVID even exists. What pandemic? COVID is a scam. It's made up by governments. It's made up by pharma by governments to control us, by pharma to, have an excuse to build and sell more vaccines, for people, for surveillance, for Bill Gates to chip us, to watch us. And it's all, anyway, you've heard it all. So it's not just about misinformation. We need to pay attention to misinformation. I like the term that Xian mentioned, misleading information. But some of it, and the challenge in the context of a pandemic, which is full of uncertain and evolving, even science is evolving. So you have to be very careful with deleting something that may actually turn out to be true. We need to listen to rumors. In my book, Stuck, that was referred to earlier, I talk about the rumor archives in the basement of the World Health Organization. Rumors are a way that you do epidemiological research. You listen, particularly in the case of outbreaks like Ebola and other places, where you want to hear, smallpox even at the end of the eradication effort, you want to hear about every last possible case, and you rely on rumors. So some of them can turn out to be bad, negative, incorrect, and some of them can be important clues. So it makes our job to try to get the right information a challenge. But a lot of this is about emotions. It's about beliefs. Again, the people who were refusing, it's not about the language you use. It's not about the way you tell the story. It's just something that's deeper, that just says, I don't want it. I don't trust it. This was in London. COVID is a hoax. COVID is a lie. And the other challenge we've had in COVID, as you know well, is that we've had some national leaders who one would have expected them all to line up in the face of a fatal pandemic to be going with the science, and that just wasn't the case. Masking became a political statement. Vaccine choices are even dividing populations. So this is something deeper. It's about anger with the government. It's about other emotions, anxiety, fear. That's not anger, but just it's all too new. I'm scared. I don't know. And I never, why would I get a vaccination in a sports stadium or in a tent? I want to go to my doctor. I trust my doctor. It's a familiar environment. So this whole issue of foreignness. There's also hope and empathy and compassion. I work a lot on risk also because it's kind of the inverse of trust. The more trust you have, the more you're willing to put up with a little bit of risk because you have enough trust in the outcome. If I don't have trust in the health system, I'm more likely to be less willing to take a risk with a new vaccine they're giving. If I have a lot of trust and confidence in the system, I'll say, okay, I know there's a little risk, but I trust your judgment. So they're kind of an inverse. But we often, in the scientific context, we think of risk as analysis. We're always talking about benefit and risk. But actually what people think about is risk versus risk. Risk of the vaccine, risk of the disease. But we're rarely talking about what Paul Slovic, who's one of the key risk scientists, calls out, and that's risk as feelings and risk as politics, which are really important dynamics. Indonesia is a fast. Sorry, I was timing myself before and I didn't mean to record it. I was referring to Indonesia as a really important example that they brought together the scientific basis for, this was for the measles rubella campaign, because they had had a lot of resistance from the Muslim community. When they introduced COVID vaccine, they remembered that there were some religious leaders that resisted the measles vaccination campaign. So when it came to COVID, they went not only to the science, but they turned to the religious leaders and said, we would like to do this. We want your blessings. Literally, we want your blessings. And they brought together both the values from the public side and the science. And this is something we don't do enough of. So I often champion them. On the hope emotions, Bolivia has created their whole COVID vaccination campaign around the notion of doses of hope, esperanza, which I thought was really a fantastic, not because it works, it's going to save you, but it's hope. It's hope not only to prevent the disease, but to get through the pandemic. As you know, and Hong Kong's kind of in the middle here, but this was this week's data, but there's a huge spectrum of acceptance of vaccine, and that has a whole mix of reasons. Aside from willingness, it's also supply reasons, which we understand. But I'm going to my last couple of slides are really on this issue of mandates and do mandates work, and start to think, as we start thinking about a post-COVID world. Vaccine mandates can work, but when they work immediately, but they may have in a good way in terms of actual uptake, but they may not work for the trust building in your population. This is some recent data that showed when the mandate was introduced in Canada, in France, in Italy, initially the uptake went up, but then it staggered later. And the French research, they found that you can encourage vaccine of many who are hesitant or reluctant, but they still have a deep hesitancy. So the next thing, but they're taking it kind of because they have to, because they want to go to that pub or bar or rest cafe, or they want to go to that rock concert, or they want to go to the movie, and they need their COVID pass, but they resent it. They even did research that interviewed people after getting vaccination. How do you feel? And what was really striking is that there was a growing number of people who had a lot of at vaccination, were getting it, they were there, but they said they had some or a lot of doubts or reticence about doing it. They're doing it because they feel they have to, they're being forced to, but they still aren't confident. And some were actually overtly angry. They came in there angry, they left angry, and that anger will stick with them. So my advice to some authorities has been, when you make these decisions, don't just think about this immediate uptake of vaccine. actual vaccination. But what is this going to do to the sentiments of your public that you need their trust moving forward for COVID recovery? But also, we've fallen behind on a lot of vaccinations that need catch up. Do we want publics to be angry and be thinking about their anger at the COVID vaccine when it comes to the catch-up vaccines for their children? That's important to consider. And the other thing that we found in this whole situation was, in all of our research on COVID vaccine acceptance, of all the different socioeconomic demographic factors that affected people's willingness to take a vaccine, the one that was the highest, and not by a small amount, the one that correlated the highest with people's willingness was how they felt the government was handling, badly or well, the whole COVID response, not just vaccines, but did they trust them? Did they feel they were confident in them? And this is just the book. And I put this up here as much to show you the contents, because it's not about individual vaccines. It's not about efficacy. It's about dignity and distrust. It's about people's sentiment, about their perceptions of risk, and how volatile, and each one tells stories of different vaccines in different populations, about the contagion of emotions, how fear or hope or panic sometimes has a contagious effect, not just in a common setting, but now how that has changed the dynamics with the online internet, the power of belief. And then the last chapter is on pandemics and publics, but interestingly, this went to press just when COVID was announced. There will be so I did get a little bit of a prologue in time, but the second edition, I've written a longer prologue that is reflecting on 2 years of COVID, and that'll be coming out in the next 6 months, the second edition. But as was mentioned, it's also going to be in Chinese, Japanese. And this is our website. You can see a lot more on research, and we're constantly changing the latest news. Sorry, I rambled a bit too long. I'm sorry if I interrupted shorten the Q&A there, sorry.
No, we're good. Thank you so much, Heidi. I think we'll bring everybody to the screen now. We've had a lot of questions coming in from the audience. We had 3 questions that came in before the program started. I'll start and go back to Boaz. And one of the questions was, is there any kind of difference in the response by gender in your language study?
Yeah, it's a good question.
Yeah, I don't recall a systematic difference, and it's actually true in our language studies in general, that if there is a gender difference, it doesn't seem to be replicable or consistent.
And this idea, I'll stay with you, Boaz, for a moment. This idea that people who said no were not easily persuaded, to move up the ladder of deciding to get a vaccine. What do you believe is behind that?
I think Heidi is the one who she actually talked about this. The people who don't want to do it are very, very strongly against it. There's nothing you can say that would change their mind. In fact, I would bet that the more you say, the more convinced they are that they shouldn't change their mind. So I must admit, I am completely perplexed by this phenomenon, and I wanted to ask. I'll be curious to hear why people are so afraid of the vaccine and not of the virus.
Well, Heidi, I heard a previous talk of yours where you mentioned that the anti-vaxxers were more persuasive in getting the people that sat in the middle and were on the fence, persuading them to their side. I don't know if you'd still say that that's true in our current situation, but can you speak to that, the persuasive ability of the people who say no?
Yeah, I think it's still I mean that reality is still there, and I think a lot of it is that the pro groups really hang together and insist on having one voice and one reality, whereas those who are critics and questioning vaccines, they're constantly listening, they're searching for people's concerns, and they break into smaller groups to address those concerns. They'll reach out and they'll find people who are questioning, go, you are right to be concerned. This is why you're right to be concerned. You're right to be afraid. It's true that, you have these suspicions. But they, in this big global analysis of different social media groups, for instance, online, and of course that doesn't capture everyone, but I've seen that phenomena in real life, where, or in offline life, I should say, where you saw these big groups. In fact, the numbers of people pro-vaccine, the individuals, are much bigger, but they'll put themselves in, say, 4 big groups, whereas half the number of anti-people will split into 10 or 12 groups to be responsive and it's more like they have more startup mode than the old IBM Blue model, and it works. And that's, and people feel like, and this was the other point in my book, the chapter on dignity and distrust, the sense of dignity and the feeling of these people in the middle that they're brushed aside when they question the pro groups as, oh, don't be silly, just, it's good for you, take it, versus the other group that listen to them, that endorses, that gives them the opportunity to have their view. And so it's about that, I think.
The psychology behind this is so interesting to me.
Yeah.
And the idea behind people who are vaccinated and pro-vaccination almost feeling timid about trying to convince somebody to get vaccinated. I know that is, in my case, with people that are around me and family members who were hesitant, it's really hard to have a direct conversation because you feel like you may see them digging their heels even more and continue to resist getting vaccinated. So Xian, I have a really important question for you, given the work that you do and given where we're at in Hong Kong right now with this situation with over 6,000 cases having been announced today. Dynamic zero, dynamic clearance, whatever we're calling it. Are we ready for it? Are your data models telling you what we need to do to be ready to wipe out the number of cases that we're seeing now?
Actually, we are not directly working on these issues. So what we have done, because our project has just done last year, at that time, the COVID-19 problem is not as severe as today in Hong Kong. So at that time, we're more interested to understand what's the general pattern of COVID-19 vaccines news coverage in Hong Kong. So what are people's attitudes towards COVID-19 vaccine as expressed in social media, these kind of questions. So we didn't directly working on predict whether what's the trend of the number of infections in near future. Actually, I know some epidemiologists are running a lot of computational models, like using a lot of Bayesian statistics methods to do the predictions, like the work has been done in the UK, like in Imperial College. They did a lot of statistical based method for infection cases prediction. But our project at that time does not aiming to predict the number of infections. We just focus on analyzing people's attitudes, analyzing their the posts put on their social media. So I cannot directly answer your question about the future trend. That's yeah.
Okay, no problem. I just thought maybe you would have a position on whether or not we're ready for that. I'm not sure if maybe Heidi, you have any thought about a zero COVID approach versus what we're seeing in the West? today and the effectiveness of either approach?
I think that a zero COVID approach is pretty risky, mostly because it's a bit like the mandate story. You know, it's good for a while, but at some point, these populations need to open their doors, and then they have unless they're absolutely fully vaccinated, they have no exposure to wild virus. And I mean, like in the case of Australia, when they first started opening the gates, so to speak, after one of the hardest lockdowns in the world, they have their pockets of vaccine refusers. So it's a challenge. And the risk is that, you know, you get, people don't get some of it's the combination of some mild exposure plus the vaccine that actually gives you the best protection. You can't rely on going to the Barrington Declaration. I mean, it's really, I feel quite unethical to say, let's just expose everybody that is, you know, less vulnerable. Well, how do you pick people out when you've got this hyper contagious, potentially fatal, and you don't know who's got the comorbidities all the time. So, you know, it's a high risk endeavor. I mean, you can do the zero, but I mean, you see what's happening. You know, you just open the door a little and and you can close it again. But at some point, if you want to cooperate in the world, which some kind of need to economically.
Yeah, you know, Hong Kong struggles with vaccinating the elderly. And so this is kind of directed at Boaz and Heidi again. Boaz, from a language perspective, you know, would you hypothesize that the elderly are being influenced by their younger, you know, sons and daughters or grandchildren who are reading in English perhaps, and then seeing things on social media and then persuading or convincing the elderly people not to get vaccinated due to the comorbidity issue? Is that something from a language perspective you can, you know, relate to your research at all?
I think it's possible. I don't actually know the situation in Hong Kong in terms of who uses what kind of routinely, where they get the information. If our research generalizes to how they read social media, then and they do it in English, then I would expect them to be the young people to be more willing to and accepting of the vaccine. So that, if anything, would push in the direction of vaccination. I'm not sure what you know, it could be that different generations behave differently, and we didn't look at a breakdown of that. So it's really the issue of trust. You know, going beyond Hong Kong, I can expect that languages will behave differently in different places. Like, you know, if we think about Europe, if you think about immigrants, like maybe Arab immigrants to Europe, it might be that in Arabic they would trust the information more. We do not know, and that's an empirical question. That once you figure out what language connects you better, makes you trust the information more, you can decide which language will be most effective in communicating the information about the vaccine.
And Heidi, how about you with social media? I know you spent a lot of time doing research on social media and its impact on some of these different conspiracy theories that people like to quote and the impact it has on hesitancy.
Well, I mean, we did research on specifically investigating the impact of misinformation in a sample of 4,000 people in the UK and 4,000 in the US, comparing exposure or not, or straightforward fact information versus. And in both the US and the UK, there was over 6% drop in willingness to take a vaccine after having seen these pieces of misinformation and the mix of other things. So that was quite strong. But I think that, like in the case of the elderly in the Hong Kong and their grandchildren, they've got this mediator who is familiar, who's family, and who speaks their dialect even. So even if it starts in English, that's where I think we're not doing enough research, is this cascade effect. When it jumps from a WhatsApp, image, and I've seen situations where people, do a print screen, print it out, tack it on a tree in some countries, read it on the radio, read it at their, in the pulpit or in the temple or in the mosque, whatever, and make it their own. So, when you have these people who absorb and communicate the information, it doesn't start in their language, but then it gets translated not only to their language, but through a very trusted figure. That's where we have the challenges.
Okay, interesting. Just any other questions that you might have for each other? We're kind of coming up on the top of the hour, and I know Boaz has to teach in the upcoming hour or so. Do you have any questions for each other about each other's research, global view of this topic, the local view of this topic? I have one other question if you don't have anything for each other.
I want to ask Heidi, when is the new edition coming out? I want to read the.
They say they want it out by the summer, but in the meanwhile, I'll make sure you get the current version, and then you can read the other part.
Do you each feel comfortable, starting with Boaz, telling people what they should do right now with regard to vaccination? Can you give anybody in the audience that are still hesitant any idea of kind of like how you would convince them to get vaccinated, or whether you would do that?
I have no problem telling anyone to go get vaccinated immediately. The science is there. It's very, very clear. The vaccine is safe. And what is very clear also is that the virus is deadly. So you should be, if you want to be afraid of something, be afraid of the virus, not of the vaccine. Because the vaccine will save you, the virus might kill you or your family members.
You're hired.
Heidi, what would you tell people? What would you tell people, Heidi?
I would, of course, encourage people to get vaccinated, because even though it feels like Omicron, for instance, is milder, it's milder if you've been vaccinated. It's not milder at all if you haven't been. In fact, it's probably stronger because you have zero, you're not protected. You might have a bit of exposure, but it's not going to keep you out of the hospital or the grave. Forgive me for saying, but so I would really encourage it. If people were questioning it, I usually first try to hear their view before I kind of try to encourage them, because then you kind of get a sense of where they're coming from. When people are really heels dug in, I try to find something else that we can agree on. There's a lot of things you can talk about right now. How are you doing? In the context of COVID, people are going through all kinds of things. I think the important thing is they feel like you care about their well-being, and not just, as they say, jabs and arms, which is what a lot of them resent. And sometimes you're not going to change their mind. And these days I try to say, well, I hope at least you're getting your kids vaccinated for the next measles round, and leave it with that.
Yeah, and Xian, do you have any thing that you would say to the audience about getting vaccinated?
I think there is no silver bullet. The survey analysis made it clear that one methods will not work universally for everyone who is hesitant for the vaccine. So for combat vaccine hesitation, we need to be more creative about micro-targeting through trusted individuals and local organizations in communities. So starting like we can use it as a reference by a Yale professor tested a variety of text messages to promote people to get flu vaccines, offering one potential tool to encourage those who aren't rushing to get COVID-19 shots. So the most effective nudge was reminding patients twice by message by text to get their flu shots at their upcoming doctor's appointment, and using the phrasing that the shot was served for them. I think we may be possible to deploy a similar strategy for like this, like for patients who have an upcoming primary care appointment, and reminding them twice by text to ask for a COVID-19 vaccine at their appointment, and saying that maybe the vaccine is reserved for them. So that would be helpful to increase the vaccination rates. Yeah. So yeah.
You took the words out of my mouth. Don't rely on social media for your answers. Go see your doctor, talk to your doctor, and get the answers from your doctor.
Yeah.
Yeah, that's great. Thank you so much for all the work that all of you do in this area. It's not just important for trying to beat COVID now, but I think these are important lessons for us to learn going forward in the future. Thank you so much for joining tonight, Boaz, Xian, and Heidi, and for sharing all your knowledge. I'm sure the audience members have had a greater understanding of the importance of the need for COVID vaccination. For the audience members, we have a brief poll on tonight's program for the audience on Zoom. If you're watching us live on Facebook or YouTube, you can also leave your answers in the comments section on those two platforms. And while you complete the survey, I'll tell you a little bit more about the upcoming programs that we have. Next week, we have episode 2 of our COVID Life series, which will be Thursday, February 24th. I believe it's the same time, 8:30 start. We'll discuss how countries and organizations have been tracking COVID with big data, data visualization, and analytics. We'll have an expert from Tsinghua University who is working on zero COVID, dynamic clearance, dynamic zero, as we call it here. And then we'll have an expert from HKU and an expert from the University of Chicago who's doing a lot of big data analytical work in the United States, just so we could do a bit of a comparative assessment of the different approaches. So you'll learn more about dynamic clearance, the approach being used in the mainland, which was also announced recently that we'll be using here in Hong Kong. And then in March, we have another 1.5 degrees, the climate change series that we feature, where we'll be talking in another episode about the global energy crunch, followed by another program in March on the Greater Bay Area. So make sure you follow us on Facebook, Twitter, Instagram, YouTube, and the UN Campus website for more information about our programs. And have a great evening, and please stay safe.